This UK doctor left his patient mid-operation to go and sleep with a nurse. Let me explain. Yes, it sounds insane and possibly a plot that you've seen on a different kind of platform, but it did actually happen. This is Dr. Suhail Anjum, a consultant anaesthetist who worked at Tameside Hospital in Greater Manchester, and he's made nationwide headlines recently because of this incident, because everyone's accusing him of gross misconduct. But what did bro actually do? Well, the incident in question actually happened a couple of years ago. It happened on the 16th of September 2023, so literally 2 years when you're seeing this video. But it happened at Tameside Hospital in Ashton-under-Lyne. Dr. Anjum, who was then 44 years old, he was performing a gallbladder removal surgery, so obviously a pretty serious surgery. And because of this surgery, the patient was under general anaesthetic. They were put to sleep so they don't literally see people digging about in their insides. And this is where it just gets absolutely insane, because Dr. Anjum asked for a comfort break. A comfort break is just such a weird way of phrasing this, but he asked another nurse to basically watch over the patient while he was gone. But obviously, bro didn't just go for a comfort break, did he? In fact, the only thing that he was breaking was backs, as he went into a nearby operating theatre and had sexual activity with one of the nurses. This nurse, for whatever reason, her identity hasn't been released. Literally no one knows who this nurse is. She's just been referred to as Nurse C. The episode lasted about 8 minutes, which a lot of people have made fun of, but I thought that was a really long time, to be fair to him. But then literally the worst thing that could have happened to Dr. Anjum in that time happened to him. Because another nurse, they walked in on him. This nurse has been named Nurse NT, but reports are saying that this nurse walked in on them in a compromising position. Yeah, I'd say a doctor putting a nurse on all fours is pretty compromising, to be fair. But Nurse NT exited quickly and then reported them a short time after. Just imagine having to report that. You've got to report 2 of your colleagues for having a full body exam at work. But what makes this situation even worse is the fact that Dr. Suhail Anjum is a married father of 3. He has a whole family and everything, and this is where he's getting up to in the workplace. Obviously, you can't help but feel sorry for his family, especially with how public all this information is now. Like, the BBC posted a video, it got like millions of views and millions of likes, and that was just one of literally hundreds of headlines about this situation. But he did say that he was struggling with his wife, and that they just had like a premature birth or something like that, which is obviously horrible, but like, you can't excuse this kind of behavior. Obviously, just leaving your patient on the operating table under anesthetic just so you can go get a quickie, it's not good. But thankfully, the patient didn't receive any physical harm or anything like that from this situation. But they do have a mint story to tell at the next family gathering, don't they? But after the incident was reported, the hospital conducted an investigation, and Dr. Anjum was eventually dismissed from the trust in February 2024, and he's apparently now relocated to his native Pakistan. But more recently, and this is why all this stuff has been brought up again, a medical practitioners tribunal service hearing has been held concerning his fitness to practice. Basically, at the tribunal, he said that he wants to resume his work in the UK and relocate his family back to the country, because it sounds like he didn't just go to Pakistan on his own. Like, he literally just took them all with him, despite like what he did. But on Monday, the tribunal determined that Anjum had put his own interests before those of the patient and his colleagues, which I think even I could come to that conclusion. I've got the IQ of a coat hanger. But they said that the incident involving Nurse C had the potential to distract Dr. Anjum, and he may not have been able to give his full attention to the patient's care. Now, as far as I know, he's never denied doing an 18+ bleep test with the nurse. I'm pretty sure he's been honest about the situation the entire time. And at the tribunal, he promised that there would never be a repeat of a one-off error of judgment. And when he was given evidence, he said that it was quite shameful, to say the least. I only have myself to blame. I let everybody down, not just my patient and myself, but the trust and how it would look. What about your wife and children, mate? Now, this woman is Rebecca Miller. She's the tribunal chair. She said that his actions, while they didn't harm the patient's safety, were significant enough to amount to misconduct that was serious. However, Rebecca Miller was satisfied that Anjum was determined not to repeat his past misconduct and considered the risk of repetition to be very low. Apparently, there's going to be no sanctions imposed on him. The hearing will reconvene literally today as I'm recording this video, basically to decide whether or not to put a warning on his registration. If he does get this warning, it'll basically just be like a formal warning, basically saying that we don't like that you dashed and smashed on a patient, and it wouldn't mean that he can no longer be a doctor. And with the tribunal finding the risk of repetition to be very low, severe sanctions are very unlikely. But obviously, you can't excuse his actions at all. When you go to a doctor, you're arguably at your most vulnerable state. You put a lot of trust into them, especially if they're operating on you. So the fact that he's just leaving to give a nurse an 8-minute round of applause, that is very worried, especially if you're the person who's whose gallbladder was getting removed. But let me know what you guys think about this in the comments. Should he still be able to be a doctor or not? Leave a like, subscribe, and I'll catch you guys in the next one.